Welcome back once again. We are going to continue on with the axial skeleton. And we're done with the skull, but we've got one little bone we're going to talk about in the neck. And then we're going to move down into the trunk and talk about the important bones on both the anterior and the posterior portions here in the trunk. So let's start off with if you're following along in your study guide, there is one bone in the neck that sits there by itself. It's not connected to the skull. It's this one, and that is called your hyoid bone. It does not articulate or form a joint with any other bone, which is very unusual. Now you do see here that it is connected to these gray tissues here that you're seeing. Those are ligaments and cartilages that surround the larynx. So that bone is not actually physically touching any other bone. It does not form a true joint with any other bone. Now it is attached to muscles. There are a lot of muscles that connect to it, and the tongue connects to it. You got your tongue up here, and it is actually anchored. Did you know your tongue extends that far back? It is anchored onto the hyoid bone. And there are some features on the hyoid bone. You can see the little pointy features on there. They do have names. We don't require you guys to know those for our anatomy classes here. All right, now we're going to move down further into the trunk, and let's do the sternum. The sternum is pretty easy. The sternum has three regions to it. So if we highlight all of those together, there's your sternum or your breastbone. The sternum actually, when it's developing in the fetus, it starts off as three separate bones, but eventually those three bones completely blend together with osseous bony tissue. So it becomes one single bone. Now that's in contrast to the bones in your skull where you have the suture joints, where bones get really close to each other, but there's always a little strip of dense connective tissue there that never ossifies or converts over to bone. That's not true in the sternum. The sternum becomes one uniform piece of bone. But it still continues to have three regions. The top one is called the manubrium. That's that one. Let's see. Then the main portion here is called the body or the gladiolus. That's an older term for it. And then finally, this little portion down here is called the xiphoid process or the xiphoid process, a little pointy portion, and that's actually the part of the sternum you have to be careful with. If you're doing CPR on somebody, you don't want that breaking off and maybe puncturing the heart of the person who you're actually trying to save with PCR. CPR. PCR is a molecular biology, biotech type thing. So sometimes I may say those backwards. All right. Now how about your ribs? Those are going to be the next things we're going to talk about. All right, so everybody has, I don't care if you're a male or a female, you have 12 pair of ribs. And they are grouped into three different categories based on the traits that they have. So your top 7 pair, 1, 2, 3, 4, 5, 6, and 7 on each side. You have a left and a right. I'm just going to highlight the right-hand side here. These are called your true ribs, or more correctly, the vertebrosternal ribs. And vertebrosternal tells you what these ribs connect into. Vertebra refers to your vertebrae. So if we rotate the skeleton around like this, you can see that each of those ribs that I have highlighted there is actually contacting a vertebra. There's a vertebra there. Now let me re-highlight my ribs. 2, 3, 4, 5, 6, and 7. And if we rotate back around on this side, each of those 7 ribs flows directly into the sternum. So that's why they're called the vertebrosternal ribs or true ribs. Let me deselect those. Now the portions here where you can kind of see the change in color a little bit from the bony portions of the ribs, that's hyaline cartilage tissue, rib cartilages, which you may want to take a closer look at on some of the diagrams in your textbook, because they don't have a very good color contrast here between the bones and the hyaline cartilage. So each of those bones, if I highlight one of those here, see how there's kind of an indentation right there? That's actually where the bone cuts off, and then this is all hyaline cartilage that's connecting over here into the sternum itself. But each of those 7 ribs, the cartilages that they are attached to, flows directly into the sternum. So that's your top 7. All right, how about the next 3? 1, 2, and 3. These are called your false ribs or your vertebrochondral ribs. And hopefully you remember that chond refers to cartilage. So over here on the posterior side, all of your ribs contact a vertebra over there on the posterior side. And then over here on the anterior side, those 3 ribs, they all kind of flow together. You can see right in there. And then that connects into the cartilage of this rib. So those ribs extend from a vertebra on the back to the 7th rib cartilage over here on the front. So that's where they get their name, vertebrochondral. And finally, the lower 2 pair of ribs on each side, I'll highlight them over here on both sides. They're just called vertebral ribs or floating ribs. So they're connected to a vertebra on each side, but then they don't connect to a rib cartilage or a costal cartilage. That's another term we should certainly know, costal cartilage. If you guys remember from chapter 1, that term costal refers to the ribs. That's a regional term that refers to that. So those are also called your floating ribs because they don't connect to a cartilage and they don't connect into the sternum. All right, in terms of naming ribs, it's pretty straightforward. All right, so is it a left or a right rib? And then they're simply numbered from top to bottom. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So you just count from the top. So, and then you provide the category that the rib is in. So you would say, for example, this one is the left, number 3 vertebrosternal rib. This one down in here, let me deselect all of those. How about let's move over here to the right. This one would be, counting down from the top, 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. This is going to be our right 10th vertebrochondral rib. So that's pretty straightforward, not too hard. Bottom one there, right number 12 vertebral rib. You can use true, false, and floating ribs if you would like. I would strongly prefer, though, that you learn the actual clinical terms. And they're very logical, so they're not too hard to learn. You just have to practice the spelling. Okay, the next thing we need to talk about are some features of individual ribs, of an individual rib. So let me select one rib over here, and I'm going to get rid of everything else. Let me say goodbye to that rib. All right, so let's zoom in on this rib over here. Let me kind of get it centered, and I'll try to zoom in. All right, so this is actually the anterior portion of the rib, and then this is the posterior portion. So let me see if I can get this rib rotated around over in here. All right, and then now we're looking at the posterior portion of the rib. All right, and the posterior portion of the rib actually contacts a vertebra. So you would have a vertebra over in here that it's contacting, and I'll bring that up again shortly so you can see it on the actual vertebral column. So a rib has a head. The head portion is just right in there. The head portion contacts the vertebra. All right, and then you've got this portion where it narrows, and that's called the neck. And then not too surprisingly, the rest of your rib here, where it curves around, is the shaft of the rib. And of course over in here, it's going to connect to a costal cartilage. And it really does kind of cut off in a straight line like that. So that's not too hard. And then let me show you the rib tubercle. The tubercle is a little bump that also contacts the vertebra. Let me see how the little bump is modeled here. Let's see. Yeah. All right. So if I kind of rotate that around that way, hopefully you can see there's a little bump-like feature right in there, and that is the rib tubercle. And so the rib tubercle contacts a particular location on the vertebra that it articulates with, and then so does the head. The end of the head contacts a different part of the vertebra that it is articulating with, forming a joint with. And let me pause for a second. I'm going to bring up the whole vertebral column back so we can see how the ribs articulate with the vertebrae and get a better visual on that. All right. Let's zoom in over so we can get a good zoom in here. Move down, and I'm going to highlight this rib right in here. And hopefully you can see here, there's our rib. And do you see how, all right, so there's your rib tubercle, that little bump there, and it is contacting this portion of the vertebra that flares out. We're going to take a look at the features of vertebrae shortly, but that's one place that the rib contacts the vertebra. And then over here as well, that's another portion where the head of the rib is contacting the vertebra also over there on that side. So two different points of contact, or two different articulation locations between a rib and a vertebra. Okay, and I'll kind of rotate that around so you can get some additional views there. And you kind of see too how the heads of the ribs actually contact portions of two vertebrae that are adjacent to each other. You can see that as well there on the diagram. Okay, I'm going to stop this particular video clip here, and then we're going to move on, and we will do the vertebral column next.